today I'm kind privileged to announce that today webinar is a holistic medicine. As you know that this is a healthcare approach that considers the whole person, body, mind, spirit, and emotions. The quest for optimal health and wellness, often incorporating both conventional and complementary therapies. For the discussion of the webinar, we have the eminent personalities like Dr. R.K. Tuli. He is considered as a father of holistic medicine, Indian father of holistic medicine, and established Soham Institute in the New Delhi, Trends College, New Delhi. And we have Dr. Gulati. He is a vice chancellor, eminent ENT specialist, vice chancellor of Mahatma Gandhi University, Jaipur. And we have the very eminent personality, Padam Shri, and HOD of the Community Medicine, All India Institute of Medical Science, Dr. C.K. Chandrakant Sambhaji Pandava. And no need to introduce one of my mentor, Dr. A.K. Agarwal Sahab, Arun Agarwal Sahab. He is an expert and very soft spoken and very eminent personality in the healthcare personality. He's a right now, he's a medical advisor, clinical research and innovation, Apollo Group Hospital, and ex-dean of the Maulana Azad Medical College. I request to Dr. Agarwal, please moderate the today webinar. Thank you.
Thank you, Tiwari ji. Good morning to all my friends, colleagues in front of me. Today morning is very special. Let me convey my thanks to Double Helical and Mr. Tiwari for organizing this webinar regularly as much as possible. And today's topic is very, very different. And this is nothing but the holistic medicine, which is the need of our, which is perhaps everybody in India is looking towards holistic medicine. But in what way? What is holistic medicine? What is the approach to holistic medicine? What is the legal approach to the holistic medicine? What is the public requirement of holistic medicine? These are the important topics which we are going to discuss through our expert. Tiwari has already introduced the three experts of today. Needless to say that Dr. R.K. Tuli is practically originator of the holistic medicine in this era. And of course, he started quite long back with the Apollo Group of Hospital. And now he is having his own wonderful setup. Welcome, Tuli Sahab. Our next expert is Dr. Achal Gulati. Dr. Gulati is my friend, our friend, colleague, and he is the person who started his career as professor of ENT and then as administrator and principal of director of many medical colleges. And thereafter, he headed the biggest organization for Indian medical profession, that is NMC, as president. And now he is vice chancellor of a very important university for our country, that is Mahatma Gandhi University of Medical Sciences, Jaipur. And my third expert is a person who is, I appreciate him from bottom of my heart, the person who is leading the public health activity for the country. And he is the person from All India Institute of Medicine, of Medical Sciences. Pandey Sahab, you know, I started my career also from your department in AIMS. So with this, I will like to start the discussion. And first of all, I like to invite our friend Dr. Tuli. Dr. Tuli, we are going to discuss today holistic medicine. You are a person who did your education in modern medicine or allopathic system, and then started your career, and ultimately you turned into holistic medicine. What was the reason, and what is the strength of holistic medicine? We'd like to hear from.
I'm grateful to Professor Agarwal for such an elaborate introduction, and my gratitude to Double Helical for having created this opportunity where Dr. Agarwal has already said that there is a great need in the country and all over the world. And the World Health Organization has been recommending that since no one system of medicine is perfect, and its program Health for All 2000 AD and subsequent efforts have failed to bring in health for all. So they have said that this is essential that we complement the best practices of modern medicine with the various traditional systems of health. And there's WHO document which also promotes this. So now holistic medicine is an approach to the human being as a whole, not merely the physical or the organ-related super specialty approach as being practiced in modern medicine today, but taking the human being as not only the body, the mind, and the soul. That is the invisible factor between life and no life. Even Hippocrates, father of the modern medicine, had made this observation that the greatest factor in our getting well is the invisible life force within each one of us. And also, Hippocrates had stated primum non nocere, that is, first do no harm. Unfortunately, in the practice of modern medicine today, there is no single medicine or intervention which can promise us this. And also the World Health Organization is very aware. If I read a document by the World Health Organization which states that unsafe medication and medical errors are a leading cause of injury and avoidable harm. The cost of which is in medication errors has been estimated at 42 billion US dollars annually, which is about 4 times the national health budget of our country. So with all these things combined, so treating the human being as a whole helps us to overcome this inherent limitation of modern medicine. It is well supported by the Charaka Samhita, by our Ayurveda, which treats the human being as a whole and says it is the duty of the physician to take care of the health of the people. Now, you asked how my transformation started. Well, one, I will give the credit to my teachers in my alma mater, the Armed Forces Medical College, where in 1964, the address to the incoming students by the then dean was that young men and ladies, you have come to this college to become doctors, but the aim of this institution is not to only make you doctors, but to play the role of a friend, philosopher, and guide. And over our clinical years, our teachers emphasize the practice of conservative medicine, which becomes very valid today when most of the diseases are being attributed to lifestyle disorders. I would say not only the non-communicable diseases, even the communicable diseases can be highly attributed to the lifestyle disturbances which compromise with our immunity. So that set of mind I continued to practice in my formative years, and I found then, I mean, in the early 70s, that the people who had just been detected with the diabetes or a hypertension, and I was an aviation medicine specialist looking after the fighter pilots, which requires the highest level of fitness. And when and they go through a very detailed annual medical examination, and if anybody is found to have slight variation, is immediately grounded, and that means he loses his career. And my duty is to keep the pilot flying. If the pilot fails to do his medical test, that is I take it as the failure of my duty. So when we found that any freshly detected diabetes or hypertension or even asymptomatic coronary artery disease, these could all be reversed by correcting those days what was called the risk factors, and which have taken the shape of lifestyle diseases now 50 years later, and medical science finds no. So at the primary level, this must be enforced that we follow and do the lifestyle changes. Even the latest textbook of Davidson says that unless an emergency, everybody should be, for a period of 3 to 6 months, try to correct their lifestyle. That is the practice of conservative medicine, and help the person to naturally regain, and that will give the person a lifelong of health instead of reducing them to making them dependent on the medications, and no medication unfortunately is a perfect remedy, and it takes its toll sooner or later in the shape of target organ damage and multiple diseases, needing to visit various specialists and creating more and more morbidity, progressive morbidity, even respiratory diseases, which is a very common cause. Today, the official figures state that since 1990, the incidence of respiratory diseases has increased by 40%. And all the drugs that they do is palliative relief. There is no cure for any of these things. But by complementing the best practices of modern medicine with these drug-free modalities, I have a vast reservoir of experience, including the who's who of the country, to endorse that this helps them to reverse their disease. And today I'm in a state to mention that this all-inclusive approach to health, complementing modern medicine with the drug-free modalities. I said drug-free modalities because there's a question coming up that we cannot prescribe medicines from different systems of medicine, of different systems of health to the same patient concurrently, because they are, number one, their philosophy is entirely different. Two, there could be unknown drug interactions, the hazards which we do not know about. But you believe me, my experience, that there is no need to use any drugs at all. When we are talking of that, we use the complementary methods. For example, the Ayurveda. Ayurveda is a lifestyle. Ayurveda is like the food we eat. As Hippocrates said, use thy food as thy medicine. And even Ayurveda says, you are what you eat. So, with this lifestyle and living a yogic way of life, yoga is Ashtanga, living a yogic way of life. And this very yoga, the science of yoga, has been developed by the Chinese into what is called a system of acupuncture, which is nothing but restoring the homeostasis of the individual. Now, with these galaxy of experts, medical experts on the panel, sir, I would submit to you that there is no medical intervention which helps to restore the cause of the disease. I am designed to be in good health. That is, my homeostasis or my milieu interior is in harmony. by following the wrong lifestyle, further inflicted by the various medications, I further damage my homeostasis, and the disease only keeps on increasing and growing, raising the morbidity and taking me to a level of. So these practices help us to restore the homeostasis of the individual. And human being is not like a machine which cannot repair itself. It does not require a continuous uh, replacement of parts or transplant of the organs, etc. You give them in a reasonable time. All this can be reversible. Like I say, earlier the better. Once a person has developed a problem, the earlier it is tackled, and we restore the homeostasis of the individual, as is the
Dr. Tuli,
nature, that the healing
Dr.
process
Tuli,
takes
sir,
over. Yes, sir. So
we are just in the first round, we are talking about
yes, sir.
the
So the having
fundamentals of the
restored,
concept. Yes.
now these
Then we'll
alternate
come to,
systems. Yes, sir, one
yes.
minute. These alternate systems help us to restore the homeostasis, thereby my own natural healing mechanism, and which at any stage of sickness helps us to restore. Having eliminated the cause of sickness, it helps to restore the health and a higher state of health, what is called wellness. Yes, sir.
Thank you, Dr. Tuli, for your for speaking out of your experience and what you felt, and I appreciate that right from the beginning when you joined Armed Forces Medical College, the whole concept you picked up, and then it ultimately turned into a holistic approach.
Now, example, I would what transformed me. You see, I was doing my PG post graduation MD medicine at the Army Hospital in the year 1976-77, and that time a professor of anesthesia who had just returned from China, having undergone training in acupuncture and analgesia, and all the head of departments from Delhi's medical colleges, the Chinese had invited them to show how the analgesia, the in major surgery, works without giving any anesthetic drugs. And but the surgeons would not permit these anesthetists to do this gimmick in the operation theaters, and the government of India set up pain clinics in all the Delhi's hospitals. And part of that, uh, our professor there, Colonel Chandani, he was awarded 2 research projects on bronchial asthma and chronic backache. And I saw most of these patients who were referred there, they were started getting well. And you know, after nearly 50 years, there is no cure for bronchial asthma. And one of the biggest causes of pain and disability in the human being remains is the backache. So, and I started taking interest because I thought if I can learn acupuncture, it will make me a better physician. And professor told me, look, you are a budding physician. I am at the fag end of my career, and I have never been a clinician as an anesthetist. I have not directly handled the patients. So this thing will prosper in you. And I went to China uh, to get the training in acupuncture. And one day in a class, if class was being held in an open space, and I was leaning against a tree. And suddenly I found there was tremendous itching on my body, and I fainted and I collapsed. And I regained my consciousness, and there were a few pins stuck on my body, and my anaphylaxis had been overcome within a few seconds or a minute or two at the most. So that I got an opportunity to use this in a patient who was suffering from severe asthmatic attack. I was still practicing my medical practice, and in fact, it was a doctor who worked nearby. And she developed a severe attack of asthma, and she got her adrenaline and aminophylline, and she came to my clinic to administer to her. And I gave it to my nursing assistant to load these into the. And in the meantime, I stuck 2 or 3 acupuncture needles on her, and she did not need those, drugs at all. It definitely worked much faster than those intravenous aminophylline would have done that. So from there on, then I took several courses in China. I went on, and I found that it helped successively in tackling medical emergencies much faster than the parental administrations. And thereby it gave me the courage and gradually started using it in the patients, and my practice got shifted from what I practiced as a very well reputed medical physician to now to the practice of acupuncture. Then it was all the time worrying me how acupuncture works, and eventually found the answer. Acupuncture is nothing but accelerated yoga. It is therapeutic yoga. If yoga is the way of life to keep ourselves healthy, acupuncture helps us to restore that same status, as I said, homeostasis. It restores my milieu interior by restoring what the Chinese have called the yin and yang. In yogic language, we call it the Ida and the Pingla, and in our medical parlance, we'll call it the balance of the sympathetic and the parasympathetic, which unfortunately no drug in the world is dedicated to. So from there on, gradually, and then of course the chronic ailments, as you see, all the lifestyle diseases, etc., remain incurable. The morbidity keeps on increasing, and that's what has encouraged me. And over the years, from the country's who's who, including the families of the President of India, the Prime Ministers of India, the Union Health Minister, Union Health Secretary's wife, and down the line, so many people. It is now I call it is a, having now practiced it more than 40 years, I say it is a very predictable, reproducible, and sustainable with a high rate of efficiency, and it can be practiced anywhere. Yes, your question, having asked me what is the most, you see, it's like I was on a high altitude trek to Gangotri back about 30 years ago. And there you have a night halt. And we reached there, and there was a commotion. A man had been brought in who had developed this acute mountain sickness at an altitude of nearly 15,000 feet. He was pale and blue, and there was no medical assistance available. I went and offered my service, and I had no gadgets, nothing with me. And with my bare hands, I tried to do his acupressure or acupuncture. And this gentleman got revived in 10 to 15 minutes. And 20 minutes later, he was sipping tea. And there was a great applause. So that acute mountain sickness fortunately got repeated on 2 successive my trips to Kailash Yatra, as well as to the Everest Base Camp. I went to celebrate my 75th birthday, to test my physical health, to Everest Base Camp, and there also one of the team members developed acute mountain sickness, and we could now, having had the added experience of years, we could cure him, and he could get back safely to his home. So it's amazing. I say everybody who wants to be a good doctor. So then from acupuncture to yoga as a way of life, because I come and patient comes to me, I don't merely relieve their symptom. I must tune them into way of life. The Ayurveda, I don't need to give them any Ayurvedic medicines, because Ayurveda is more about lifestyle. You ingrain them into, while they are undergoing the therapy with you, you teach them the philosophy and the correct practice of yoga. And you see, unfortunately, as you all know, yoga has been just made these physical asanas, exercise. And some of these great yoga teachers have done great injustice to this way of life by only enhancing the yoga asanas, etc., or at the most the breathing exercises, the pranayama. But the yoga lies in yama and the niyama. And of course, pranayam, asanas, dhyan, dharana, pratyahara leading us to a state of samadhi. But what is most important is the yam and the niyam. So we inculcate that in the patients, and that makes the when the patients come, they may be suffering from acute problems, they may be suffering from a range of problems. For example, a diabetic. Now they may come because they have got severe neuropathy. That is one of their greatest problems. The diabetes, with the best of medication, even insulin administration has not got fully controlled. They've developed a foot drop, or they developed symptoms of paralysis, etc. And within next few days, as we get onto this intensive therapy, the blood sugar levels start getting controlled. The patient's dependence on medication, the dose of medication starts progressively reducing, the symptoms start vanishing, and they recover. Now, it
Okay,
is
Dr. Tuli.
definitely very creditable,
Hmm.
and that's what
Thank
makes
you.
me
I
what I
think
am. That
you
I
definitely
make a
gave us.
statement today that
Hmm.
all diseases at any stage can be reversed. Of course, earlier the better. So let people not wait and aggravate their problems. And we include this. Now, Dr. Gulati said that there is a National Medical Council. You see, National Medical Council is there to control the modern medical system, its practices and its various aspects of this. But our government has followed the national health policy on the WHO recommendation that there should be an approach to health. That's why there's a Ministry of Ayush, that we could make an optimum synergy of all the different systems. And as I said, once the patient is on a allopathic medicine, patient is in a acute state of sickness, in a tertiary under tertiary care, you cannot give any other drug to them in any form. But by regulating the life force, as Hippocrates had identified also, by reinforcing the life force, by restoring the homeostasis, I give the example to my patients. I say, human being is not a machine which cannot correct itself. Human being is a gift of the nature. As you see, 90 you pluck out 90% of a tree, and it will start growing all over given the optimum conditions. So the human being has got infinite condition. I say even the body parts are chopped. I developed various injuries. Given proper care, the human being has the potential of regenerating, rejuvenating, and recovering. And that's where all the degenerative diseases can also be reversed.
I
डॉक्टर
think
गुलाटी ने
you
कहा
should be one of the happiest person
जी जी
if this thing comes in a manner
जी
that, well, the implementation of the concept of holistic medicine, that is the biggest problem. And once it is there, then acceptance amongst public.
जी
तो वो भी एक इम्पॉर्टेंट फैक्टर है जिसके लिए कि जब एक बार सिस्टम शुरू होगा तो एक्सेप्टेंस भी आएगी। आप मुझे ये बता दीजिए कौन सा ऐसा बंदा है जो कोई ना कोई होलिस्टिक अप्रोच फॉलो नहीं करता है किसी चीज।
life is a wholesome approach.
जी
There's so many aspects to the life itself, but good health is the need to have a life. Like there is a Vedic saying, धर्मार्थ कामा मोक्षमम शरीरम मूलम उत्तमम आरोग्यम मूलम उत्तमम, कि अगर आपको जिंदगी में कुछ भी पाना है तो उसके लिए एक अच्छे स्वास्थ्य की जरूरत है, और उसमें हमारे देश का जो आज कार्यक्रम चल रहा है, तो उसके लिए सबसे पहले स्वस्थ भारत ही विकसित भारत हो सकता है। तो स्वस्थ भारत वो तब होगा जब उसकी जितनी दवा के ऊपर निर्भरता कम से कम होगी। डॉक्टर गुलाटी ने बहुत अच्छा कहा कि देर इज ए सिम्बायोटिक रिलेशनशिप। यस, होलिस्टिक मेडिसिन इज सिम्बायोटिक रिलेशनशिप। आपने कहा लॉ ऑफ द लैंड, लॉ ऑफ द लैंड हमारी नेशनल हेल्थ पॉलिसी कहती है देयर शुड बी एन इंटीग्रेशन, बट समवेयर because of lack of expertise and clinical evidence in this, we have lagged behind. And that's where one, I will like to highlight the difference between holistic medicine and integrated medicine. Now, integrated medicine is we use a combination of all the available systems of health.
सर एक सेकंड सर, एक सेकंड
जी,
सर, अपन इंटीग्रेटेड मेडिसिन नहीं, इंटीग्रेटिव मेडिसिन की बात कर रहे हैं सर।
okay, okay, yes.
They are two different entities, sir.
Correct, correct. So that integrated medicine cannot work because you cannot prescribe medicine from different systems to a patient. Now, integrative also, अब जो WHO की डेफिनेशन है, आप जानते हैं कि 1986 में वर्ल्ड हेल्थ असेंबली ने कहा था कि ये डेफिनेशन फिजिकल, मेंटल, सोशल वेलबींग इज नॉट इनफ विदाउट एडिंग स्पिरिचुअल वेलबींग टू इट, जो कि आज तक WHO इंप्लीमेंट नहीं कर पाई because of whatever the forces that govern the WHO. But हमारा जो आयुर्वेद और योग है, that functions on the spiritual aspect of health. तो इनको, और इसमें हमको कोई दवाई की जरूरत नहीं, तो in no way it conflicts the because कुछ भी आप कहें, हमारी कंट्री में भी 95% of the budget is allocated to Ministry of Health and only 5% to Ministry of Ayush. और आयुष में भी 5 डिपार्टमेंट हैं, तो इट्स लाइक री इन्वेंटिंग द व्हील। पर जो हमारा मिनिस्ट्री ऑफ हेल्थ है, दैट मीन्स जो हमारा हेल्थ केयर सिस्टम इज एसेंशियली बेस्ड अपॉन द मॉडर्न सिस्टम ऑफ मेडिसिन, right from the primary, secondary and tertiary levels. Now, we as belonging to the same system, we have to do SWOT analysis. किसकी strength, weakness, opportunities, or what we are trying to achieve. And that can be achieved by adding the spiritual dimension to the WHO definition. अगर WHO खुद कहती है कि there should be an integration, और WHO की जो एडवाइजरी बॉडी है, वर्ल्ड हेल्थ अथॉरिटी, वो कहती है कि स्पिरिचुअल के बिना हेल्थ नहीं मिल सकती, और बड़े बड़े साइंटिस्ट ने ये माना है, क्योंकि ह्यूमन बीइंग एट द कोर इज ए स्पिरिट, दैट लाइफ फोर्स विच कैन बी रेगुलेटेड। और इन चीजों को अपनी जो मॉडर्न मेडिसिन की प्रैक्टिस में कंबाइन करने में कोई आपत्ति नहीं है। आपने बहुत अच्छा कहा कि आई विल लाइक टू कम, उसका हमें एविडेंस चाहिए, और उसका एविडेंस के लिए यू आर आवर लीडर, लेट अस कम एंड कंट्रीब्यूट आवर experience, expertise to it, and develop scientific evidence, and from there on let us take up with, as I said, my transformation started with 1977-78 when I saw these patients getting well at the army hospital from bronchial asthma and backache. और ये भी मैंने कहा to complement the best practices, मॉडर्न मेडिसिन के बिना हमारा गुजारा नहीं, वही हमारा आधार है। हमारे देश की जो स्वास्थ्य सेवा है उसी के ऊपर निर्धारित है, पर उसको इंप्रूव करना है, उसके अंदर जो कमी है, जो कमजोरी है, उसको हमने उभारना है, ताकि हम इस देश में स्वस्थ भारत ही विकसित भारत हो सकता है। हमारा खर्चा दवाई के ऊपर नहीं, सेहत के ऊपर हो। आज
बिल्कुल सर,
आज जो आयुष्मान भारत है वो 5 लाख रुपए की आपको फ्री फैसिलिटी देता है बीमारी का इलाज करवाने की, पर आपको वो फैसिलिटी नहीं देता कि आप बीमारी से बचने के लिए भी कुछ कर सकते हैं। और मैंने ये भी कहा कि हमारी 95% जो हेल्थ केयर प्रणाली हमारे देश में इस सिस्टम के ऊपर आधारित है, तो पर इसकी जो कमियां हैं, जो यही तो स्ट्रेंथ, वीकनेस, अपॉर्चुनिटीज एंड रेमेडीज, उसको हमने उभारना है। हमारा काम जो हम कर रहे हैं हमको उससे बेहतर करना है, उसको बेहतर कैसे किया जाए जिसमें हमारा नुकसान भी ना हो और फायदा भी हो, चित भी मेरा पट भी मेरा। तो
बिल्कुल
दिस
ठीक
इज
है।
व्हाट द ड्रग फ्री modalities when we complement it helps us even at the tertiary care stages, at every stage of health. And if but we cannot forget the good that modern medicine is doing to people. हाँ, इसको
That goes without
मेरे
saying.
मेरे विचार में सर, जो आज मेडिकल इंटरवेंशन है, इसको कैन बी ब्रॉट डाउन सिग्निफिकेंटली by reinforcing our primary health care with these drug free modalities. इसमें बहुत जरूरी है कि जो हमारी हेल्थ एजुकेशन है, स्कूल हेल्थ एजुकेशन, वहां से बच्चे की सेहत का सुधार होना शुरू होना चाहिए. It should become a way of life. Not for that they have to come to the doctors. बिल्कुल
दुख
सुख
काहे
में
को
सिमरन जो करे, दुख काहे को हो. और हमारी फौज में कहते हैं, those who sweat in the peace time don't bleed in the war. What is most important is the emotions of the people. The pollution starts in the mind. If my mind is wrong, all my choices will be wrong. Whether
आप
it is,
मेंटल हेल्थ की बात कर रहे हैं?
no, sir, spiritual health.
नहीं,
If
मेंटल
the
हेल्थ और स्पिरिचुअल भी तो लिंक्ड है
spiritual
ना।
wellness controls my emotions and my mental health, and thereby my physical health. Human being is a spiritual being at the core. As Lord Shiva said, without Shakti I am Shav. That Shakti is my life force, which Hippocrates said is the greatest factor in my getting well. Because if I am spiritually healthy, all my actions, all my yam and niyam, the yoga lies in the yam and niyam. That will be healthy. The whole society, the whole universe will reform. And that is the purpose that our Prime Minister's campaign of has brought yoga as a International Day of Yoga, a universal recognition from everywhere. Yoga is to nourish your spirit, keep the harmony between the microcosm and the macrocosm, or the Jivatma with the Paramatma is the nature's intelligence which governs us. We have to be in alignment with that nature's infinite intelligence which knows us, which makes me grow from a microscopic cell, seed of my mother and father, to a great human being. That is the nature. We have to understand and respect the nature's intelligence. Sarve bhavantu sukhina, sarve santu niramaya. ये प्राप्त करने के लिए हमें एक दूसरा वैदिक मंत्र, तमसो मां अस्तो मां सदगमया, तमसो मां ज्योतिर्गमया, मृत्युत मां अमृतगमया. तो इस को पाने के लिए हमें अपने स्वास्थ्य को स्वस्थ रखना है, और वो किसी दवा प्रणाली से नहीं आ सकता. इट हैज टू बी health
within
education
yourself.
right from the school on to the university and to the medical. Yes, when things have gone wrong, we need to take care of that, but 80% of our health will lie in the primary health through health education, and that will reduce load on our tertiary care. So our tertiary care will become even more efficient, and not because today the crowds are so much in the tertiary care that it loses its quality. The quantity takes off the quality from there. That will help the people the
Thank you.
best.
Thank you,
And
Dr. Tuli.
I am healthy if I am on no medicine. As WHO says, health is not merely absence of disease, but a state of positive wellness, body, mind, and soul.
Absolutely correct.
One of my professors used to always say कि बहुत पैथी है, सबसे बड़ी पैथी है एम्पैथी.
सर हैप्पीनेस पैथी जो है ना सबसे बड़ी है.
एम्पैथी,
Yes.
यस. आप एम्पैथिक होंगे, आप खुद खुश होंगे, आप दूसरों को खुश रख सकेंगे.
हाँ सर.
आप खुद,
So I
आप
think
पहले डॉक्टर को खुद स्वस्थ रहने की जरूरत है, तभी वो लोगों को स्वस्थ रख पाएंगे. The future of holistic medicine, this lies with the public. As in his opening address, Professor Agarwal said कि इसकी जरूरत और डिमांड हर तरफ बढ़ती जा रही है. तो जिस चीज की डिमांड होगी उसी की सप्लाई होगी। आज मुझसे अक्सर पूछा जाता है कि होलिस्टिक मेडिसिन इतना लाभदायक है तो लोग इसको समझते क्यों नहीं है। हाँ, वो चेतना जाग रही है, हमको उसकी सर्विस प्रोवाइड करनी है। उसके लिए हमको डॉक्टर गुलाटी के साथ तय हुआ कि हमें उसका एविडेंस, क्रेडिबल साइंटिफिक क्रेडिबल एविडेंस बनाना है। तो ये जब सब लेके आएंगे, इसकी शुरुआत हो चुकी है। इसकी शुरुआत हो चुकी है कि लोगों को उसका फायदा पहुंच रहा है, परंतु उसकी सुविधा भी नहीं प्राप्त है और उसके लिए एविडेंस भी हमें अपनी तरफ से ये देना है। तो ये मिलके जो, अगर हम स्वस्थ भारत का प्रचार करते हैं तो उसके लिए हमें, जैसे हेल्थ की डेफिनेशन है, नॉट एब्सेंस ऑफ डिजीज बट स्टेट ऑफ पॉजिटिव वेलनेस, और वो सिर्फ एक हेल्दी लाइफस्टाइल से आ सकता है, जो कि
थैंक यू।
जो कि स्कूल से शुरू होना चाहिए और मेडिकल करिकुलम में भी आना चाहिए। और हर डॉक्टर को ये सोचना चाहिए कि मैं अपने पेशेंट को बिना दवाई कैसे ठीक करूं, जिसको बोलते हैं कंजर्वेटिव मेडिसिन। इट इज ए वेरी मच पार्ट ऑफ द मेडिकल करिकुलम, ना कि लोगों को मैं जल्दी से जल्दी इमरजेंसी में, हाँ, जानलेवा बचाव के लिए जो दवाई लेनी है वो जरूरी है, मगर जो लाइफस्टाइल डिजीज है वो सब बिना दवाई के ठीक हो सकती हैं और उसके लिए डॉक्टर्स को प्रोएक्टिव होना पड़ेगा।